Good morning, everyone. This is Lusami T. Bungar, a first-year student of Bachelor in Physical Education. So today, I am going to discuss to you about a visual impairment. So at the end of the discussion, we have these learning outcomes. Identify and understand visual impairment and physical and health disabilities. Identify, understand the classification and causes of visual impairment. So, visual impairment from the word itself, impaired, meaning having a disabilities of a specific kind, either weakened or damaged. In this case, it is the visual relating to sight or seeing. Visual impairment, it is refers to the disabilities to see. So, like anang bulag, bulhog, or yung one-eyed lang ang nakakita. Visual impairment is a general term used to describe people who cannot see even with corrections. The Individuals with Disabilities Education Act, or IDEA, further explains that it is impairment in vision that even with correction adversely affects an individual's educational performance. So, in what way siya nakaapekto sa educational performance? So, syempre, if you are blind, it is really hard for you na makisabay sa mga mag-aaral na kagaya natin. That is why there is a so-called special education that accommodates the educational needs of people with these abilities. It includes problems and visual acuity like nearsight or eyesight ka ba. Visual field, ang lawak ng iyong paningin, like for example, you are looking straight to something. So, ang iba kung ano yung tinitignan, yun lang talaga ang nakikita nila. Yung iba naman, kahit nakatingin sila sa straightforward, pero nakakita pa rin sila sa gilid or other area. And for serving the color like blurred ba or hindi. The condition may vary from one person to another. One person may have the remaining vision while others have remaining functional vision. So ito yung sinabi ko kanina na may blind, yung wala talagang makikita, yung one-eyed, yung malabo ang mga mata at marami pang iba. So we have a classification of visual impairment. Individuals who are legally blind have minimal light or form perception. He has 20/200 vision in the better eye. That means if an object is 200 feet away, you have to stand 20 feet from it in order to see it clearly. Where is an individual who is totally blind completely lacks vision or totally without any sight, as in like wala dyo'y makita. Both legally and totally blind are dependent on their tactile and auditory sense as the channel of learning. Those who are partially sight have limited perception with the environment. They also use their sense of touch and hearing as a way to learn about their environment. A person is considered as having a low vision when he still has a residual or meaning vision that he can use with the help of perception or non-perception devices. Typically, the person cannot read a book or newspaper at a normal distance even when he is using eyeglass or contact lens. And there are also people who are deaf-blind. They have limited vision and hearing. Braille and sign language are both in use to train these individuals. So let us proceed the causes of visual impairment. First is myopia or nearsightedness. The individuals can see clearly the objects is close to him. This is the result when the rays of light from the distant objects are not focused on the retina. So, myopia occurs if the eyeball is too long or the cornea, or the clear front cover of the eye is too curved. As a result, the light entering the eye is not focused correctly and the distant object look blurred. Next is hyperopia or farsightedness. This is the opposite of myopia or nearsightedness. The person who can see clearer if the object is far from him. In this condition, the light rays near the objects are not focused on the retina. It is a refractive error, which means that the eye does not bend or refract light properly to a single focus to see image clearly. In hyperopia, distant objects look somewhat clear, but close objects appear more blurred. Next is astigmatism or blurred vision. The person sees a blurry image of the things around him due to the curve and the cornea or lens. As a result, the curve prevents light rays from focusing the retina, just like myopia and hyperopia. Astigmatism can be corrected through the eyeglasses and contact lenses prescribed by the ophthalmologist and optometrist. Next is cataracts. The person with this condition experiences a blurred, distorted, or incomplete vision due to the cloudiness of the lenses because of trauma or old age. Since the lenses of opaque or cloudy, this blocks the light needed to see clearly. Additionally, the person can be photophobic, may experience serious glare problems and squinting. It forms when protein builds up in the lens of your eye and makes it cloudy. This keeps light from passing through clearly. It can cause you to lose some of your eyesight. Next is glaucoma. This condition occurs when the aqueous fluid fails to circulate properly. The pressure in the eye caused by the fluid can damage of the optic nerves. Next is diabetic retinopathy. From the name itself, diabetic individuals are affected with this type of eye disorder. This occurs when there is hemorrhage and continuous growth of blood vessels in the retina. It is often treated with laser surgery. It is commonly caused by the high blood sugar from diabetes. This is when high blood sugar levels cause damage to blood vessels in the retina. These blood vessels can swell and leak, or they can close, stopping blood from passing through. Sometimes abnormal new blood vessels grow on the retina. All of these changes can steal your vision. So next is retinitis pigmentosa. This is the gradual degeneration of the retina. It can result to night blindness, photophobia, and loss of macular vision. Sadly, this condition is inherited and not treatable. So, genetic disease that people born with. The next is Usher syndrome. This is a deaf-blind condition which is a combination of congenital deafness and retinitis pigmentosa. It is a rare genetic disease that affects both hearing and vision. It causes deafness or hearing loss and an eye disease called retinitis pigmentosa or RP. Sometimes it also causes problems with balance. Next is macular degeneration. This condition is typically to adults, but it can also affect young people. This is due to the deterioration of the central area of the retina cones. Visual fields are lost, but the person can use his peripheral vision. This person may be photophobic that affects his color vision. Next is retinal fibroplasia, typical to premature babies who are overexposed to oxygen in the incubator. Next is the nerve atrophy, damage of the optic nerve. The optic nerve carries image of what the eye sees to the brain. Next is ocular albinism, a genetic condition that primarily affects the eyes. This condition reduces the coloring or pigmentation. So, those are the different classification of visual impairment. Moving on, let us talk about a school-based program for people with visual impairment. In the Philippines, one can rarely see a student with vision loss and inclusive education. Most of them are studying in a special school. The Philippine School for Deaf and Blind in Pasay City specializes in teaching students with such as condition. Special education teachers who will teach students with vision loss need an intensive training in using the braille. The following are some suggestions for teachers who have students with low vision. First is train the child to use his functional vision. So when we say functional vision, it is the processing and use of visual information and the performance of visual related tasks. Reading, driving, or recognizing individuals at a distance or in a crowd. You should let us the child use his functional vision. So, kung saan sila hiyang. So, ganun dapat, di ba? Next is eliminate classroom properly. You have to make sure that you will be heard by the students without shouting or yelling. There is no way around it. Teachers need to be able to project their voices and command attention with them. The students sitting at the back of the classroom need to be able to clearly understand what you are saying. Learning how to properly project your voice without yelling is a skill our teachers need to learn. And the next is have the sight to sit near the blackboard. This is the applicable to the students who are nearsighted. And the next is give a photocopy for the lecture notes or shorten the notes. So, para at least na sila own copy para mabasa nila at mas mapadali nila ang lecture. And the next is verbalize the writings on the chalkboard. Sometimes you need to read and dictate what is written on the board so para maintindihan ng mga students. And the last is avoid cluttering the board. So that's all my reporting.